Okay, my name is Alice Denga. I work as the matron in the assisted conception unit, a role I've been working in for over 10 years. I love it because it's all to do with the patient experience and to make sure that their journey is as seamless as possible. When patients have been referred to the assisted conception unit, it is very important that we support them all the way through. So it starts off from pre-assessment. That's the first appointment where we have the opportunity to see them, speak to them, get the history, get things going, make sure we do with all the proper investigations that we need to do in order to move on to the next stages. And you start developing a relationship. You also make the patients feel welcome to the unit at that time, because that's the first time they are coming to see us, so it's important that we get things right. They then come to see the clinicians. They leave that appointment with a date to come and see the clinicians for their initial consultation. And again, when they are seen by the doctors and we make a decision as to how we're going to look after them throughout the cycle, there is a nurse still who is going to take them through that journey at the back of that appointment, sort of to reassure them, to give them an opportunity to ask any questions on the things that they may not understand at the time, and start ordering their medications, start explaining their treatment schedule on how they can manage things all the way throughout their cycle, and also just getting that reassurance as to their point of contact as nurses and any questions and any issues they may have. So the next time the patients will come back to us is when they come in for their scans and they're ready to start treatment. And again, during that time, it's the nurses who scan the patients, and we actually work in pairs, whereby one of the nurses will scan the patients and the other one will take them through on how to do their medications, because that's a very important part of the treatment. They have to understand which medications they're going to use and at what time. So they are seen by one of the nurses, they scan them, then the next nurse will explain the medications and what happens all the way through, until we continue seeing them again. Again, it's the nurses who will see them for the follow-up scan to make sure that they are ready for the next stage, which could be egg collection or which could be a rescan. And again, we work in pairs, whereby one nurse will scan and the other nurse will then tell them about the next steps. They will then come back to have their eggs collected when they are ready for egg collection. And again, when they come, they meet lovely recovery nurses. And in fact, this is the best part of their care, where they don't have to worry about any injections and just to focus on their sedation that they will get on the day. Again, this is very well explained to them by the nurses all the way through. So they'll be seen by an anesthetist on the day, and the clinician is going to do their egg collection, and all they have to do is just relax, have their eggs collected, and again be looked after by the nurses in recovery until they are ready to go home. When they come back to have their embryos put back in, again, there's a nurse present on that day to work with the doctors, to scan them as well, to reassure the patient, and also to make sure when they leave at that time, they've got the right information before they actually do their pregnancy test, what symptoms to look out for, any questions they may have at that time, and also just making sure when they have to do their pregnancy test and to get back to us with the results and all of that. The nurses are all throughout. The nurses are involved with their case. My nurses, they are fertility nurses, very thoroughly trained. Even for the nurses who are working in recovery as well, they actually go through recovery competencies. ACU to our patients, it's the privilege of using NHS service within a setup that is almost like a private unit. It's amazing when you get compliments from patients when they come to us and they think we're actually private, but in fact within NHS unit. So there is that benefit. Patients like that. They like the environment. Our clinicians that are working within ICU, they've got a very good reputation around. We offer evidence-based medicine to our patients, and that's what we're known for. I like being part of the team because we're a very dynamic team, we're very creative, and we listen to our patients. I like the idea of engaging our patients all the time. I would recommend to patients not only look for results, but also to look at the integrity around a unit. That's what I would recommend.